Hello friends, today we will discuss the survival strategy for MRCPCH clinical examination. Uh, at least 6 month study is needed, but it is very individualized decision. Somebody can take the examination with 1 month study and somebody can take 1 year. So it depends on you in which space you are doing study and how is your preparation, what are the practicing option you have. So at least, but ideally at least 6 months I believe it is needed. Every day you have to spend at least 3 hours doing study. Out of these 3 hours you have to do the revision for all the system, at least for which will take at least 1 hour, and 2 hours you should utilize for studying the new things, the guidelines, as well as the other books. And practice and more practice. There is no substitute in this examination. Without practice you will struggle, so just do practice as much as possible. These are the list of book I recommend you to read. The first one is the Essential Revision book written by the Mark Beatty. This is the Bible of for this examination. You have to read this book at least 20-30 times. This number may sound absurd, but if you read the book the first time, it will take at least 2 weeks time, but the next time when you read, you will finish it very quickly, and I will tell you the secret strategy to read the book quickly in the later half of the video. The next book is a pediatric guideline book, which is very important because UK treatment mostly guideline based, evidence based. So you just need to read a few essential guidelines like asthma, constipation. So these are the very important guidelines you have to read. UTI. Oh, I forget to mention UTI is very important. So you just need to read all those guidelines. Next is the NHS neonatal protocol, which is another guideline book you need to read. And these two guideline books are equally important for the part 1 and part 2A examination. So you just need to read those books very well, and just write it just make a note of all these guidelines, because all these guidelines are very volatile, very difficult to memorize. So while doing the study, just make a note of all those important guidelines. For communication, I recommend the Rebecca. This is a very good book you can read, and which almost cover most common scenarios. And please read the clinical governance and the audit section. So these are the very important for the clinical examination. For videos, you can watch the YouTube videos which are readily available, widely available, so you can watch the videos from there. And the clinical circuit book you can also read. I didn't read during my preparation, but later I go through the book, which is a very good book. I can recommend that thing to read. And developmental milestone you have to practice from RCPCH chart, which is available in their website. How to start? The start and the beginning is always difficult because inertia is always pulling you and delaying things. And start reading from the Essential Revision book, which is a very good book. You have to start reading it as quickly as possible and read it like reading a storybook. So that is the mantra to read the books, because there is no picture, so you may feel bored. So but you have to read it. Before start reading any system, try to discuss with your mind how much you know about the subject. Suppose you are going to start the respiratory system, just ask yourself, how, if you have been given a scenario or a patient to do the examination for the respiratory system, how would you proceed? Just ask yourself, analyze yourself, how much you know about it. Then you start reading the book. Then you get to know where you are lacking, what are the important points you are missing. Then you just supplement your knowledge from there, and I believe that you will improve after reading the book, and you will not feel bored if you follow this strategy. And always remember, in examination nothing will be asked that you don't know. So just be confident, just think logically, and then I think you will perform well. I have full faith on you. How to practice: revise every day the following: all the system, all the system examination scheme for the all the system you have to memorize every day. Respiratory, GI, CVS, CNS, musculoskeletal system, thyroid, as well as a short stature, obesity. So these are the examination scheme you have to memorize every day. You can practice in front of the mirror, or when you are just coming back from your work, you have 1 hour train journey, you have to do, just do practice all those time, utilize all those time that you feel uh, you feel that these are not these are not actually. You have to put yourself in different scenario, in different pressure situation, to memorize all those things, because examination is just airtight situation. You have to mug up all those things, you have to memorize all those examination scheme. If you practice, then only you can survive all those critical situations. Developmental milestone, you have to practice every day. You have to memorize those developmental milestone at least once. Then only you can memorize in those with stressful situation. And scheme of taking history is also very important to memorize every day. Just memorize at least once. I think you can do it. Mock test, it is extremely essential to take the mock test. At least 5 mock tests you have to take before the examination. That is my recommendation. If you struggle to arrange the mock test, you can contact me, I can arrange it for you. Because mock test, by giving mock test you will understand how to manage the time. Are you too fast or too slow while taking the history? You have to be very good observer, you have to be a very good listener, you have to act something sometimes. So you have to be empathetic, and you have to be systematic and concise and all, just specific for, so you have to give the mock test and prepare well before the examination. And you can take some revision course. So these are the crash course, you can take it as a crash course. There are different day long, 2 day long courses are available in under RCPCH. You can take all those courses, one of them, but it is very costly. So but you can take it, I can recommend that it for that's for you as well. And just think about the pass fail criteria there. So just go through my video for the pass fail criteria, as well as you have to be a little bit over cautious about few things, like if you forget to examine the back or the spine in CNS examination, you could be brutally marked. So yes, you have to know all those important points. You should say, or else you would be brutally marked down. Like in CVS examination, if you forget to mention you have to take the four-limb blood pressure. And these are the very important points that you shouldn't miss. So by doing practice, you can only cop up all those things. And just go through my videos, everything have been clearly mentioned, what are the things you have to perform. So just think about the pass fail criteria. If you fail, then what is to be done? This is extremely expensive, and after, if you fail the examination, don't get disheartened. Take a short break, and try to try to analyze the feedback, because every candidate will get the feedback from RCPCH. So just go through the feedback very very well. Then you will understand where you're lacking, where you, because in examination you may not know what is, maybe you are thinking something but you are saying something. So that's why the mock test is very important. So just go through the feedback very very well and restart reading as soon as possible. I know it's very difficult to restart reading if you fail in a examination in that big stage. So it's really frustrating, but just restart reading. In that way you can cope up and fight those depressive mood and the frustration. So just believe me, just restart reading as soon as possible and book the exam. Don't skip the taking the examination, because after taking the examination, suppose your level, suppose a level you have achieved, you are there almost to pass, just suppose you are just short by 1 or 2 marks. So there is no reason to just take a break in between those exams, just because you are almost there. Just a little bit extra push can pass all those things. It can make the scenario different. So just to book the exam, unless you book the exam you will not read it. So that's the natural instinct for all the humans. So book the exam and just keep trying. That is my suggestion. Don't stop, just keep trying, keep practicing. Grab your colleague, grab your teacher, grab your junior, whoever around you. Just do practice and practice. And you can, if you have kid, you can practice with them as well, because this is the ideal candidate. So please do practice and keep trying. I think you will get it through. And I wish all the best, all the very best for all the examining. So just go and just do it. I think you can do it. Just keep trying and believe in yourself. I hope you like the video. Do share and subscribe. Thank you very much.